And
Absolutely. Beautiful day in downtown Providence. Big news.
I think I see a tornado spiral over here in the southwest, though. And remember, they go southwest, northeast. So.
Big news out of Boston today.
Huge, yeah.
Preliminary.
Yeah.
The announcement that Partners Healthcare, the mega hospital system in New England.
Which we should add a couple of the names to remind people. Massachusetts General,
Right.
Brigham and Women's, McLean's, Dana-Farber, blah, blah, blah. Yeah.
A budget of $13.5 billion, 50% larger than the state of Rhode Island, 70,000 employees, and they are now in discussions with Harvard Pilgrim, one of the largest healthcare insurers in the Commonwealth. They have about 1.2 million customers.
Right. Which means in terms of people, because some of these are family policies, probably a couple of million, maybe 2.5 million.
Absolutely.
Mostly affluent.
Right. And
a lot of well-insured people there.
And if you went back 5 years ago, the idea of a healthcare hospital system merging with an insurer would be
it is happening.
It is
in
now
various
happening.
places around the country, even with some small. I wish I'd brought a list, but there's some small hospital chains out in the Middle West, for example. They're merging with locally based insurance companies.
Saul Kaplan worked with Dallas Children's Hospital and them building their own insurance structure.
That's right. Some hospitals are actually creating insurance companies. This is all about control.
Yeah.
Control, access to the customers, referrals. It's the sort of thing that's just revolutionizing healthcare in general. It's like Aetna and CVS, Aetna and then sending people to CVS and the other way around. But this thing is huge because the resources. Now, what happens if Partners wants to come down here to Rhode Island? They can't, Partners itself probably can't directly expand anymore in Greater Boston because of antitrust provisions, but they could move down here, and so this makes that kind of juggernaut, the Boston behemoth, even more fearsome.
Well,
they could come here and take over the insurance business.
Well, it's got to send ripple effects through Blue Cross and neighborhood health plans.
Pricing, where the physicians are, the deals between the insurance companies and the physician groups, all these things.
By far and away, healthcare is probably the most important. It's not necessarily the largest number of employees. That's hospitality, but the fiscal impact to the state of Rhode Island, it's about 50,000 direct jobs.
Those are generally, most of those are full-time jobs. Hospitality is very seasonal.
Right. And a tremendous number of them are high-paying jobs.
The physicians, certainly, even nurse
administrators,
practitioners, the hospital execs, which earn an arm and a leg, which irritates a lot of people. Greed is not dead in the healthcare center.
Those nonprofit CEOs do make a pretty penny.
If you really want to make a lot of money, get into the nonprofit business.
So the implications are potentially, listen, it's not going to get approved overnight. Sometimes these deals fall apart because one group thinks that they should drive the strategic train in the long term. Nobody wants to give up their multi-million-dollar salaries. But if this came to fruition in 24 months, and Partners is able to close the deal on Care New England, despite opposition from Brown University and Charter Care and a number of others, this really could be a major impact on the Rhode Island economy.
Huge impact on the economy, on the whole health insurance structure down here. It would affect Medicaid, Medicare, you name it. Huge impact. How much of this would be more draining off of jobs, of high-paying jobs to Boston? I do not know. But it would certainly have an impact. There's no doubt about it.
I don't think we've ever looked closely enough from an economic standpoint of what really happened to the Rhode Island economy when Fleet was acquired by Bank of America. There were sort of two tiers because a lot of key jobs when they did the Bank Boston merger started to move up to Boston and it became a little more Boston-centric. But the implications, this downtown, the so-called financial district, has not even come close to recovering from that deal a decade ago.
It's a little bit better now. It certainly looks better now. And I noticed this walking over. Their vacant lots are gradually being filled in. And I know people whine about the design and, too much. My friend Will Morgan complains there's too much brick. He's been on your show, you know what I mean. On the other hand, it is sort of it's uplifting in a way. I'm walking over here and I'm seeing all these places that have been vacant lots for the last 35 years getting filled in. They are not generally financial services jobs, but we should remember financial services jobs are beginning to shrink.
Yeah.
AI is going to eat away a lot of that stuff. Some of it's been offshored. Interesting things are going on as they, like Goldman Sachs is moving big operations out of New York City. There's some. Who's moving there? Somebody's moving a big operation in Nashville.
Yeah, that got announced the other day, and it was cost of labor, cost of rent.
Cost of labor, real estate, the whole thing. So I think you're going to find that the financial services business is not going to be the driver it's been since the 80s. Because so much of that stuff can be kind of technoed away, either overseas or just in a computer with algorithms.
So when we talk about healthcare, and we see a potential consolidation like this, CVS and Aetna at the top level, Partners and Harvard Pilgrim at the regional level. The dream of that stabilizing growth factor of meds and eds, the medical sphere and the education sphere that work together.
Right.
If you have medical schools, now start to fray a little bit.
It frays, and we will. It's not going to go away. In part because Boston is so close. It's 35, 40 miles away. So we're kind of the concentric circle of that giant healthcare center, healthcare research, related science stuff, biotech, and so on. So that's kind of good. That's good in a way, but it's certainly not going to be based here. We tend to continue to ignore certain things that we do have a comparative advantage. Great design people around here. Obviously the maritime stuff, the boat building, oceanic stuff in general, with the URI, the stuff going on in Newport and Woodsold being very close by.
Right.
So you've got the sort of world center of maritime stuff. I've always thought we should pay more attention to that and design, which we have an ancient tradition around here, going back to the founding of Gorham back in the 18th century. As you know, we were talking before the show about stuff in Newport. I mean, this architecture.
I'll tell you a funny story. Former head of a Boston ad agency called me up during warmer and cooler.
Holiday or
maybe one of them. And he made the comment. He's like, "What is Rhode Island ever doing, hiring a designer to do a logo out of New York? If one thing Rhode Island has is great designers."
They've got a surplus of designers. I know, it's just bonkers. Did you think of people like Malcolm Greer did the Olympic thing? I was just looking at the design
Olympics, Health and Human Services, Veterans Administration.
I just saw his name there, the website for the Newport Art Museum.
Right.
No, it's just nuts. We do this all the time. It's just crazy. And some of these big buildings that should be done by local. You think Friedrich, our friend Friedrich, Kip McMahon. I mean, we have pretty distinguished architects around here.
So to fight off on the healthcare and defend jobs and. Is it pitchforks? Do we need pitchforks at the state border? How do we protect this key part of the Rhode Island economy?
I think you do it by developing a kind of areas of expertise, mostly in outpatient stuff. Have some of the best outpatient systems in the country. I think you can do that around here.
Yeah.
Because more and more stuff is going outpatient. I mean, people are being shoved out of the hospital earlier and earlier. I had tubes coming out of me, I think, the last time I left the hospital.
When you left the hospital?
Yeah, after major surgery. And
wheeled to the parking lot, still being sewn up by...
Then they tipped me over.
Right.
That's right. But I think we could do, in this sort of intimate kind of environment around, I think we could kind of create new patterns for outpatient stuff. I did notice, by the way, that we got some kind of award for Medicaid stuff. You could give the Raimondo administration some credit, but I think there are other things going on too.
Right.
So certain things we can do well. I don't think we can do well in the big general hospital approach.
Yeah.
They're kind of Butler Hospital is very good, and they do neurological research there and movement disorders. So that can be kind of a little cottage industry. For example, the big stuff, people, it's hard. How do you compete with Massachusetts General?
Charter Care's president was on, they run Roger Williams, they run Fatima, and are now looking to reopen for outpatient and emergency room, Memorial in Pawtucket. But I thought the key thing, he was on for about half an hour with me, the key thing he uttered is, listen, hospitals are not going to look like hospitals in
No.
another 10 years.
I mean, you'll always have inpatient
Absolutely.
beds and all
Right.
that, but far, far fewer. And you have to, because of new pills, I mean, say heart disease, people take statins now.
Right.
They do a bypass and get you out of the hospital in 4 or 5 days.
Right.
So extreme surgeries and you're out. But I think just kind of geographically and the kind of the lay of the land, the population pattern around here would be a very good place to be a real kind of cutting edge, so to speak, of outpatient stuff. And I think Brown University should focus on that. I know they've often taken credit for being a very good primary care
Absolutely.
center, and I think that's the way to go. I think it's going to be, we'll always have at least one big general hospital at Rhode Island.
Right.
But I think that's going to look maybe a little too big in a few years.
Yeah.
What happens to the community hospitals like Miriam? I don't know. Miriam's got that kind of core clientele of financial backers and of patients. So
Right.
that'll go on for a while. But, you wonder, will that still be open in 20 years?
Absolutely.
It'll be
And,
open in 5, but 20? I don't
Yeah.
know. Yeah.
Michael Fine, former director of health, and I think somebody widely respected by just about everybody, and a big primary care
Yeah, he's
physician.
a primary care physician. He had a good group. You pay like
Absolutely.
a monthly fee.
Yeah,
to-
absolutely.
yeah,
And
yeah.
his argument for the past 15 years or so is we just have too many beds in the state,
Yeah, that's right.
which is driving up our costs. Memorial bled tens of millions of
Well,
dollars.
they're also built for routine, obstetric stuff. People
Right.
who have women are having a baby, they'd be in it for a week and a half, and now they're out in 2 or 3 days.
Absolutely. Let's jump over to the governor's race.
Yeah.
I think we got in the last 2 days and didn't, and the public's not engaged, so some of these get put in the proverbial trash bin.